There's really two reasons that someone becomes a fire chief, and there's two roles that we significantly own in every day of how we do business, and it's to serve and protect the public, and it's to serve and protect my members. And when we're looking at members that are struggling for the past 2 years, all of my firefighters and EMS clinicians, that's EMTBs, that's paramedics, that's my career and volunteer folks, we're seeing tremendously long wait times at the hospital. And for somebody that has sworn to serve and protect, all they want to do is be in the community and serve. And when you're waiting hours at a hospital because you have a patient that is sick, or because you have a patient who maybe didn't utilize other resources, and they felt that their only answer was to go to the hospital, it can be discouraging and heartbreaking that we feel helpless, because the one thing that we want to do is help. And I say this in great partnership with our hospitals, but the hospitals are struggling. For 2 years, we've worked diligently as nurses and paramedics to try and take care of folks. We still have a regimen of full PPE anytime we enter a home. We're still putting on the gowns. We're still putting on the face mask. We're still running the PUI calls. And we would hope to see that less and less the more our community is vaccinated. It would be encouraging to my staff and my folks to know that maybe somebody that has COVID has been vaccinated and they're going to treat it at home like a common cold, instead of somebody that has gotten COVID and has not been vaccinated. And my paramedics are wondering, am I going to have to intubate them in the back of the medic unit on the way to the hospital? Am I going to have to worry about what's going to be the next level of EMS care that I can provide? And then the staffing at the hospital, where they are absolutely struggling, are there going to be enough nurses and doctors to take care of folks? And the answer right now is no, right? There's not. There's a huge mental health component to this, the worry that my firefighters bring home to their families. And so after 2 years, we will continue to stay in the fight, because that's what we do, because we want to help, because we want to serve and protect. I think if there's a request as a fire chief, it's do the right thing for your community and your neighbors. Do the right thing for my firefighters and my paramedics who are really struggling right now. And we're just asking that everybody consider being vaccinated if you're not. Consider using the hospital systems for the right means. The waits are incredibly long. We bring patients in the back door through the ambulance, and you'll end up in the waiting room because there's just not enough people to go around. There's not enough people to help. And when they're at the hospital for multiple hours, it's heartbreaking that they can't be out in the community. The more people that are at the hospital, the more providers are at the hospital, which means that's less providers on the street taking care of our community. And there's only so much staffing to go around. We all see the staffing shortages. So from somebody who has raised the right hand to serve and protect, and as a paramedic myself who is still out in the field sometimes, my request is that you try and do the right thing, and you lean forward to protect my members and to protect your neighbors.